Hello, I'm a genetic counselor at the Peter Gilgan Center for Women's Cancers at Women's College Hospital. Have you or a family member been identified as a carrier for the BRCA1 or BRCA2 gene mutations? This video aims to help you understand the cancer risks associated with the BRCA1 and BRCA2 mutations for both men and women, provide you with information regarding the most up-to-date cancer screening and cancer prevention options available, and address frequently asked questions that you may have about being a BRCA1 or BRCA2 gene mutation carrier. Cancer is one of the most common diseases affecting Canadians today. In particular, breast cancer is the most common cancer among Canadian women and affects approximately 1 in every 8 women. In men, prostate cancer will affect about 1 in every 7 men in their lifetime. Although the majority of cancers happen by chance and are unrelated to having a gene mutation, about 10 to 15% of all breast cancers and up to 20% of all ovarian cancers are hereditary. What do I mean by hereditary? This simply means that the cancers in the family are caused by genetic changes or mutations that are passed down from one generation to the next, or what we call inherited in the family. The BRCA1 and BRCA2 genes are the most common genes associated with hereditary breast and ovarian cancers. We are all born with 2 copies of the BRCA1 and BRCA2 genes. However, some individuals have a genetic mutation on one of their copies, which causes the gene to not work the way it should, and also increases their risk to develop certain types of cancers. Now, it's important to remember that learning you carry a BRCA1 or BRCA2 gene mutation does not mean you will get a cancer, nor is it a diagnosis. Instead, it means that you are at higher risk than the general population to develop certain types of cancers. In particular, women who carry a BRCA1 or BRCA2 gene mutation have up to a 70% chance of developing breast cancer in their lifetime, as well as a 20 to 40% chance of developing an ovarian cancer. Men who carry a BRCA1 or BRCA2 gene mutation have an increased risk of developing prostate and breast cancers. Now, both men and women who carry a BRCA1 or BRCA2 gene mutation may also be at increased risk of developing other cancers like pancreatic cancer, melanoma, and possibly gastrointestinal cancers such as colon or stomach cancers. As overwhelming as it can be to think that you are at higher risk of developing cancer, knowing your BRCA gene mutation status can help you decide on the best cancer screening or prevention program for you, hopefully preventing future cancer diagnoses or deaths due to cancer. When it comes to management options, the main options include screening and surgical prevention. For screening, this can include breast mammography or MRIs through high-risk screening programs, which monitor you over time and potentially can catch a breast cancer early if it does occur. At this time, screening for ovarian cancer is not recommended, as it has not been proven to catch cancer early. For men in the family, screening options could include clinical breast exams, as well as prostate screening involving a blood test called a PSA and a digital rectal exam. Secondly, we think about cancer prevention or risk-reducing options. This could include surgery to remove the ovaries and fallopian tubes, called a bilateral salpingo-oophorectomy, as well as surgery to remove both breasts, called a bilateral mastectomy. Having these surgeries before a cancer has occurred significantly reduces the chances of it happening in the future. In addition, there are certain types of medications, for instance tamoxifen or the birth control pill, that can also reduce the risk of certain types of cancers. It is really important to remember that the decision of how to manage your cancer risks is a difficult one and incorporates various factors, including your own experiences with cancer, your family history, and personal level of worry. Everyone is different, and it may be that you and your relatives make different choices around screening and cancer prevention, and that is okay. Just remember that you are not alone and the decision is a personal one. So talk with your family, your doctors, a genetic counselor, and gather all the information you need to make an informed decision that's right for you. Aside from cancer risks, finding out that you carry a BRCA1 or BRCA2 gene mutation can be overwhelming and leave you with many other questions. Depending on your life stage, the questions and concerns you have will be different and they will change over time. For example, some people have questions about how and when to tell their children or other family members about the BRCA gene mutation. For this topic, we have developed a specific seminar that serves as a guide to talking about BRCA with your family, and it can be found on the Peter Gilgan Center for Women's Cancers website. Other individuals may have questions about how the BRCA1 or BRCA2 gene mutation may impact other aspects of their life, such as their fertility, family planning, their ability to take hormone replacement, and menopause. The answers to these questions are dependent on your personal and medical history, as well as the decisions you've made about risk-reducing surgery. And there is also a lot of ongoing research in these areas. Other questions may also include those around lifestyle or diet changes that may reduce your risk of getting cancer. It's important to know that you're not alone in wondering about these topics, and there are many resources to address your questions and provide support, although there may not always be an answer. Nevertheless, the field of genetics and our knowledge of BRCA is constantly evolving, so it's important to stay in touch with your local genetics clinic and healthcare providers for the most up-to-date information, as questions we may not have the answer to today may be addressed in the future. The Peter Gilgan Center for Women's Cancers offers free patient education in the form of seminars, a peer support program, and other resources. Please visit our website for more information.